Hi, my name is Carol Merton and I'm running for Councillor in Owen Sound. The best quality that I would bring to the table if elected is my ability to think outside of the box, to see different possibilities and solutions with the courage to push these solutions forward for a different approach. Doing things the same way means that you will get the same result. We need to look at things differently, through a different lens, and address issues and challenges in a new way. I have been involved in a community building initiative for sharing of information that links people of all ages together. This is especially important in a rural environment. I have created, co-produced, and volunteer my time to host a Rogers television program called HealthLink. This program has the tagline connecting home, community, and healthcare. I invite speakers of all ages from the community to share their community involvement, projects and programs, ideas, and vision for the future. This program has been well received by viewers and has continued to be renewed for production by Rogers TV for the last 10 years. My work in social networking continues to focus on community, individual health and well-being, accessibility, and bringing people together. I continue to work with a variety of business, education, health-related community agencies, and recreational groups to build relationships, to build community. Jobs are important, but they are not enough. Living security is a term that applies to the goal of bringing and keeping people of all ages to Owen Sound. Jobs that include reasonable work hours, pay scales, and job security is definitely part of the answer. Affordable and available housing is part of the solution. People need food on the table and a roof over their heads that they can call home. Housing, including rentals, should not cost more than 30% of the household income, and people should not be on waiting lists for affordable housing for years. Quality of life at any age does not mean scrambling to survive for the basic necessities with nothing left over to enjoy hobbies, social outings, and recreation. I do support incentives and a strong marketing plan to encourage business to set up here in Owen Sound. I support working with Georgian College for the skills and apprenticeship programs. I support and encourage workshops to help entrepreneurs get the jump start and mentorship they need. We need to start to be creative about private business development opportunities that provide variety of services here in Owen Sound. We need to open the doors to apprenticeship and volunteer opportunities within our actual municipality of Owen Sound. The pattern for young people to leave and then return to our area is both natural and historic. This occurs definitely in the ages of 18 to 24 for education or for other reasons. We need jobs to encourage people in this age group to come back home. We all gain from the learnings, experience, and perspectives of those who leave and those who return. I believe that we have a responsibility to clean up the harbor and the waterfront, but most importantly, we have to recognize that we have a responsibility around the actual harbor waterfront area to draw communities together. I suggest that we consider involving community action groups, people with the passion and who care about the waterfront. Perhaps we might consider an opportunity of inviting these groups to give their ideas and visions Maybe they can be called Friends of the Harbourfront. And the city and Owen Sound needs to provide the resources to spark this initiative, to get the people together, to provide the resources where these discussions can actually happen. This is important to our community and to our growth and development in the future, and I support initiatives to vision for our waterfront. I believe the city has a critical role in responding to the opioid crisis in our community. As a community, we need to address this life and death issue, since this crisis has an impact on all of us. We cannot afford to sit around a table to just talk about it. We need to work hard to actively link all of the agencies, emergency responders, educators, experts in addiction, and the Grey Bruce Public Health Unit. We must push the province forward to fund and communicate a clear action plan for opioids now. People are dying, and waiting is not an option. I believe certain strategies could also include ensuring that naloxone kits are readily available in all public places, schools, recreation facilities, just like the AED devices are for those in cardiac arrest. We need to educate the public, teachers, coaches, just as we do in CPR training for those having heart attacks. It does not stop with emergency care. We need to ensure that we have written policies clearly outlining a focus on education, harm reduction, fast-track addiction treatment, and appropriate enforcement. We need to set clear targets and achievable goals to measure how we are really doing on this issue. We need to keep the spotlight on these issues. Lives depend on it. I believe that public participation and input on all aspects of city life is essential. Council members cannot represent people well if they are not in tune with what matters most. Rather than looking at the number of committees, however, I suggest we need to ask the question, do we have the right people at the right table at the right time looking at these issues? More isn't always better. Focusing on common shared goals, active inclusive participation, effective leadership, and clear communication moves committees forward to action. We need to increase the engagement with committees by considering options. That could be virtual meetings, webinars, to allow more participation from our community. We need to say it, mean it, and do it.